Stop looking at your phone for the next 10 seconds and look at your hands instead, not casually. Really look, because what I'm about to tell you is something your doctor sees every single week in their office but almost never explains to patients like you. Your fingernails are keeping a medical record of what is happening inside your body right now. What you're about to see on your own hands could be the earliest warning your body has ever given you about your heart, your kidneys, or your liver. And by the time this video ends, I'm going to show you something that could save you from a medical crisis you never saw coming. If you care about your own health, or the health of someone you love, subscribe to this channel right now and turn on notifications. What you're about to hear is the kind of information that protects lives, and I don't want you to miss a single video like this. Let's go. My name is Dr. Clifford Adeshina. For over 2 decades, I have dedicated my life to one mission: giving adults over 60 the health information they deserve to have but rarely receive. Not because doctors are hiding it, not because the system is corrupt, but because a 15-minute appointment was never designed to cover everything that matters. This channel exists to fill that gap, with honest information, with real research, with the kind of clarity that puts you in control of your own health. This is not a channel for generic advice. This is a channel for the truth that changes how you live, and it starts right now. Your fingernails are keeping a medical record of what is happening inside your body right now. What you're about to see on your own hands could be the earliest warning your body has ever given you about your heart, your kidneys, or your liver. And by the time this video ends, I'm going to show you something that could save you from a medical crisis you never saw coming. If you care about your own health or the health of someone you love, subscribe to this channel right now and turn on notifications. What you're about to hear is the kind of information that protects lives, and I don't want you to miss a single video like this. Let's go. And before we go any further, I need to tell you something. In over 20 years of medicine, I have watched patients discover serious disease far too late because the warning signs were visible to their own eyes the entire time, and nobody had ever taught them what to look for. By the time this video ends, you will know exactly what those signs are, what they mean, and which organ system is actually sending the alarm. Information I believe should be standard knowledge for every single person past their 60th birthday. After you turn 60, your body doesn't suddenly fail. It doesn't announce itself with dramatic symptoms. What actually happens is slower and quieter. Your arteries begin to stiffen. Your blood vessels lose some of their elasticity. Your kidneys become less efficient at filtering waste. Your liver processes toxins more slowly. Your heart has to work a little harder with each passing year. And for the first months, or even years of this process, you feel completely fine. You have no chest pain. Your breathing is normal. You can still climb stairs. But your body is sending signals the entire time. Most people never notice them because nobody ever taught them where to look. The problem is that by the time traditional warning signs show up, the fatigue, the shortness of breath, the swelling in your legs, significant damage has often already occurred. But there is a place on your body where the alarm system begins to sound much earlier. A place you look at every single day without understanding what you're seeing. Studies show that over 40% of heart attacks in adults over 65 are completely silent. No chest pain, no dramatic warning, but the body still leaves clues. Clinical evidence suggests that changes in your nails can appear months or even years before a crisis becomes inevitable. And that window of time is exactly when intervention matters most. Think about that for a moment. Your fingernails are not separate from your internal systems. They are completely integrated into them. Each nail grows from a structure underneath your skin, called the nail matrix. That matrix sits directly against the capillary network, the tiniest blood vessels in your entire body. These capillaries are so microscopic that they allow individual red blood cells to pass through them in single file. Because they are so delicate and so small, they become the first structures to show distress when your heart begins to struggle, when your kidneys are failing, or when your liver is under stress. Think of your capillaries like the thinnest part of a river system. When the main river is flowing powerfully, water reaches even the smallest tributaries. But when the main current begins to weaken, when an organ is struggling to function, the smallest streams start to run dry first. Your fingernails are growing in that smallest stream. When circulation slows or kidney function declines, or the liver cannot maintain normal protein production, your nails are among the first places where that stress becomes visible. After 60, this becomes even more critical because your body's ability to compensate is thinner. Here's where it gets serious. Most doctors are trained to look for nail changes only when something is dramatically obvious. A standard 15-minute appointment does not include a thorough examination of each individual nail, looking for subtle color shifts or fine, horizontal lines. That gap between what the research shows and what gets communicated to patients is precisely where preventable crises happen. I had a patient named Margaret, 67 years old, a retired teacher who walked 3 miles most mornings and kept herself active. She came in one afternoon for something completely routine, a medication refill for mild hypertension that had been stable for years. Nothing seemed wrong. She felt well. Her weight was stable. Her exercise routine was consistent. During the examination, I happened to look carefully at her fingernails. What I noticed made me pause. The color pattern was different from what I would expect. The nail beds themselves had taken on a peculiar whitish tone with just a thin reddish band visible at the very tip of each nail. It was subtle enough that Margaret herself had never noticed it. She had been looking at those same nails every morning while she brushed her teeth and had simply adjusted to the gradual shift without recognizing anything had changed. I asked her some careful follow-up questions about her energy level, any new shortness of breath, any heaviness in her chest. She said no to all of it. Everything felt normal, but those nails told a different story. I ordered an echocardiogram as a precaution. The results showed early-stage heart failure that had been silently developing for approximately 18 months. Margaret's heart was losing its ability to pump blood efficiently, but her body had compensated so gradually that she never felt it happening. Those nails were the first honest voice in the room. Because of what we saw in time, Margaret received medication that changed the entire trajectory of her health. Today, she is still walking 3 miles in the morning. Without that nail examination, she would likely have experienced a serious cardiac event within the next year or two. The first thing you need to understand is that your nails can show one of several distinct warning patterns, and each one carries different clinical significance. Sign 1, pallor, with peripheral banding. The nail bed becomes unusually pale or whitish in color, while the rim at the very tip of the nail stays pink or reddish. It looks almost like frosted glass with a thin colored edge. This specific pattern is most commonly associated with heart failure, liver disease, and diabetes. A study published in the American Journal of Cardiology followed adults over the age of 65 for 3 years and found that people displaying this nail pattern had substantially elevated risk for cardiac events compared to those with normal nail coloring. The mechanism here is circulation. When your heart is struggling to pump blood effectively, or when your liver is losing its ability to regulate blood proteins, the body prioritizes blood flow to the organs that keep you alive. The fingertips become a lower priority. Blood delivery to the nail bed becomes compromised, and the nail responds by losing its normal, healthy pink appearance. Tonight, hold both hands up to a window with good natural light. Look at each nail individually. Do the nail beds appear unusually white or pale? Is there still a distinct reddish or pink band at the very tip? Now I need you to pay very close attention to what comes next. Sign 2, bicolored nails. This is where the nail is divided into two distinctly different zones. The half closer to your cuticle is white or pale. The half closer to the tip is a darker reddish or brownish color. The dividing line between them is usually sharp and clear, almost like someone drew a line across the middle of your nail with a marker. This pattern is classically linked to chronic kidney disease, but also appears in advanced heart failure. What makes this pattern significant is that it typically indicates the body has been under sustained circulatory or renal stress for an extended period, not days or weeks, but months or years. The nail is essentially showing you a long-term record of compromised function. A patient I'll call David came to see me at 73. His daughter had mentioned that his nails looked unusual, like they were divided into two colors. He had never really noticed it himself, but when I examined his hands carefully, the bicolored pattern was unmistakable across nearly all his fingernails. Testing revealed severe heart failure that had been progressing silently. His nails had been documenting this progression the entire time. The moment we saw them clearly and took them seriously, we were able to begin treatment that improved his quality of life dramatically. This next one is the one that concerns me most. Sign 3, Muehrcke's lines. Horizontal white lines running parallel to the crescent at the base of your nail. The key detail that distinguishes them is that you can see them clearly, but you cannot feel them when you run your finger across the nail. They are a visual signal, not a textural one. These lines are most strongly connected to kidney and liver stress and can signal heart strain. Research has connected these lines to heart failure, kidney disease, and liver disease, all conditions that involve circulatory stress and nutritional compromise. The reason these lines appear is that when your body is under sustained stress, your blood levels of a protein called albumin drop. The nail responds to that shift by creating these visible horizontal markers. I had a patient named Catherine, 68 years old, who was active, not overweight, and genuinely felt fine. During a visit, she mentioned almost as an aside that she had noticed some horizontal lines on her nails over the past few months and assumed it was probably nothing. I looked carefully and recognized Muehrcke's lines across several fingers. A cardiovascular workup revealed early heart failure entirely manageable at that stage. The lines had been appearing for months. Her body had been quietly asking for attention. Remember what I told you about Margaret? Her nails showed the first pattern. But I have seen patients with Muehrcke's lines, with bicolored nails, with multiple warning signs present at once. The more signs present, the more urgent the need for evaluation. Sign 4, Beau's lines. Deep horizontal grooves running across your nail from side to side. These are depressions or indentations in the nail plate itself. You can feel them. They look like your nail plate paused in its growth for a period of time, and then started again. And that is exactly what happened. When your body undergoes significant physiological trauma, a heart attack, cardiac surgery, a severe infection, any major health crisis, the nail matrix briefly stops producing new nail tissue. The growth pauses. When it resumes, that pause leaves a groove behind. Over time, that groove grows out toward the tip of your nail. The position of that groove can actually help estimate when the event occurred. Beau's lines are a general systemic alarm. They point to major stress on any major organ. What makes this clinically important is that Beau's lines can reveal a past cardiac event that you yourself may not have recognized. Silent heart attacks are more common than most people realize, especially in older adults where the classic dramatic symptoms are often completely absent. I had a patient named Eleanor, 68 years old, who came in for a blood pressure check. During the examination, I noticed clear horizontal grooves across all her fingernails. I asked her if she remembered being seriously ill about 4 to 5 months earlier. She paused and said yes, actually. She had been very unwell for several days with what she assumed was a severe stomach virus, fever, weakness, general malaise. But nothing in her chest, nothing dramatic. It had resolved on its own and she had moved on. Testing revealed she had experienced a silent myocardial infarction, a heart attack, during that illness. Her body had protected her from the typical chest pain warning because of how the attack had occurred. But her nails had recorded the event perfectly. That information changed her entire treatment plan going forward. Now I need you to look underneath your nails, not on top of them. Sign 5. Splinter hemorrhages. Look very carefully at the area beneath your nail, between the nail plate and the skin underneath. Do you see any tiny dark lines or specks running vertically through that space? These are called splinter hemorrhages. Tiny collections of blood trapped in the capillary bed beneath your nail. A single splinter hemorrhage from accidentally bumping your hand is nothing to worry about. Multiple unexplained splinter hemorrhages across several different nails is an entirely different clinical picture, the most directly cardiac sign on this entire list. In medical practice, unexplained splinter hemorrhages are classically associated with infective endocarditis, which is an infection of the heart's inner lining. This is a serious condition that requires urgent medical attention. I had a patient named Richard who noticed these dark lines under several of his nails during a routine hand washing. He mentioned them almost casually at his next appointment. We investigated and discovered early-stage valve infection that was caught in time for effective treatment. Those tiny marks under his nails may have saved his life. This final sign may be the most overlooked signal on your entire body. Sign 6. Lunula color changes. Look at the small whitish crescent at the base of each of your nails. That crescent is called the lunula. Most people think of it as simply a cosmetic feature. It is actually the visible portion of your nail matrix, the active zone where new nail cells are being continuously formed. The color of your lunula is one of the most significant but completely ignored diagnostic signals available to you. A reddish or darkened lunula points to valvular heart disease and heart failure. A bluish or purplish lunula suggests problems with oxygen delivery in your circulation, a sign that blood is not being oxygenated effectively. A lunula that has faded to almost nothing or become very pale often indicates anemia, which places direct strain on your heart because an anemic heart must work significantly harder to compensate for reduced oxygen carrying capacity. I had a patient named Susan, 69 years old. Her daughter, who happened to work as a nurse, visited one afternoon and casually mentioned that Susan's lunulas had almost entirely disappeared. Susan herself had not noticed because the change had happened so gradually. She had been looking at those same nails every single day and had simply adjusted to the new normal without recognizing that anything had shifted. When Susan had that observation checked out, testing revealed significant anemia and early cardiovascular strain. Both were caught and managed before they became serious. I want to teach you a test you can perform on yourself immediately using nothing but your hands. It is called the capillary refill test, and it directly measures how quickly your smallest blood vessels recover from pressure. Here is how you do it. Hold your hand at the level of your heart. Use the thumb of your opposite hand to press firmly on one of your fingernails for approximately 2 seconds. You will see the nail bed go pale as blood is pushed out. Then release the pressure and begin counting quietly. Do that right now. Do not wait until later. Do it while I am talking to you. In a healthy adult with good circulation, the pink color returns to the nail bed in under 2 seconds. If it takes 3 seconds or longer, and you get the same slow result when you test 3 or 4 different fingers, that is a meaningful indication that your microvascular circulation is sluggish. Research has linked persistent slow capillary refill in older adults to reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risks. I had a patient named William. He tried this test one evening and counted nearly 5 seconds before the color returned to his index finger. He tested his thumb, then his middle finger, then the fingers on his other hand, the same slow result every time. He called my office the following morning and described exactly what he had observed. A full workup revealed undiagnosed atrial fibrillation, one of the most common and dangerous causes of stroke in adults over 60. He was placed on appropriate treatment, and based on everything current cardiology literature tells us that phone call very likely prevented a major stroke within the following year. He had no other symptoms at the time. None. I want to pause here because what I just told you about William could be your story. Look at your hands right now. How long did the color take to return? Tell me in the comments. Type the number, 2 seconds, 3 seconds, 5 seconds. Do not guess. Count honestly. Your answer matters because it helps me understand exactly who needs this information most. After 20 years of watching what happens to patients who never had this information, I developed something I call the 60-second hand check. This is a system for evaluating your own hands every single month in a way that allows you to catch changes early and speak to your doctor with confidence and clarity. I want to give it to you right now because I believe it is the simplest and most powerful way to protect yourself starting today. Here is exactly what you are going to do this week. Find a window in your home with good natural daylight, not artificial lighting. Natural light reveals colors accurately. Sit comfortably and examine both hands carefully. Look at each individual nail and work through this checklist. Check the overall color of the nail bed. Is it the healthy pink you remember? Or has it become unusually pale or whitish? Look for the two-tone division that signals the bicolored pattern. Look for horizontal white lines you can see but cannot feel. Look for deep horizontal grooves you can actually feel. Look underneath each nail in the clear area between the nail plate and skin for any dark lines or specks. Examine the lunula at the base of each nail for color and size. Is it present or has it faded or shrunk? When you finish that examination, perform the capillary refill test. Hold your hand at the level of your heart. Press on 3 or 4 different nails for 2 seconds each. Count honestly when you release. Write down the results. Write down exactly what you observe. Take a photograph of your hands in good natural light. These changes happen gradually and human memory is unreliable. That photograph gives you an honest baseline to compare against in 6 months. If you observe one of these signs, mention it at your next routine doctor's appointment and ask whether further evaluation is warranted. If you observe 2 or more signs together, do not wait for your annual checkup. Call your doctor's office this week, describe what you observed, and ask if you should be evaluated sooner. Do not attempt to diagnose yourself based on what you see. Everything I have shared today is based on published research and clinical experience. It is not a diagnosis. It is a conversation starter between you and your doctor. That distinction matters. Your complete medical picture, your history, your medications, your other symptoms, your family history, is what produces an accurate diagnosis. Your job is to notice, document, and speak up. That is the part most people never do. That is the part that makes all the difference. Pallor with peripheral banding points toward compromised heart function, liver disease, or reduced blood flow to your extremities. Bicolored nails indicate sustained kidney stress or prolonged circulatory compromise over a long period of time. Muehrcke's lines reflect kidney and liver stress and can signal heart strain. Beau's lines reveal past health crises your body may have weathered silently. Splinter hemorrhages demand immediate medical investigation for possible heart infection. Lunula color changes signal anemia, circulation problems, or advanced cardiovascular disease. Slow capillary refill indicates your smallest blood vessels are struggling to deliver oxygen to your fingertips. I promised you at the beginning that you would receive something specific by the time this video ended. Something concrete you could use tonight. That something is this. Your hands have been keeping a detailed written record of your internal health for your entire life, every single day. No exceptions. The information has always been there. What was missing was someone telling you how to read it. You now have that knowledge. You understand what to look for. You know what each sign means. You have a protocol you can follow tonight. You have a capillary refill test you just performed on your own hands. That is something most people your age will never have. Most people will scroll past this information and continue looking at their hands without seeing what is actually written there. You chose differently. Every single one of those signs was visible. Every single one of those patients had been looking at their own hands for years. The only thing missing was someone telling them what they were looking at, until today. What you have just learned is real clinical information based on published research and decades of medical practice. It is not scary because it is exaggerated. It is important because early detection changes everything. You are now in possession of knowledge that allows you to have a completely different conversation with your doctor, not as a patient guessing at symptoms, but as someone who has noticed specific observable changes and is asking informed questions. That is the difference between reactive medicine and preventative medicine. That is the difference between discovering a problem after it becomes serious and discovering it while you still have time to do something about it. You are not just a viewer who watched a video today. You are someone who took 10 minutes to learn something and who actually looked at your own hands while learning it. You performed a test. You observed your body with new understanding. That decision matters. Most people your age will never do this. Most people will feel that vague sense that something is not quite right, but will not know where to look or what to pay attention to. You are different now. You know exactly where to look. You know what these signs mean. You have a system you can implement tonight. Please share this video with someone you love. Think of one person right now. Picture their face. Someone over 60 who you know is not paying attention to their health. Send this to them today, not tomorrow, today. You might be sending them something that changes everything. Subscribe to this channel and turn on notifications so you never miss information like this. What you just received is the quality of truth I deliver consistently. You deserve to have access to it. In the comments below, tell me this. Which of these signs did you see on your own hands? And what was your capillary refill time? Be honest. That answer matters because it is going to help me understand what information you need most in future videos. Your body has been working for you every single minute of your life without asking for anything in return. The least you can do is give it the truth. I am Dr. Clifford Adeshina, and I will see you in the next one. Everything I have shared today is general medical information based on published research and clinical experience. It is not a personal diagnosis or a replacement for care from your own doctor. Always consult your physician or qualified healthcare provider before making any changes to your medication, diet, supplements, or health routine.